I'm Rochelle De Vera from BSN 2A Group 2, and today I'm going to demonstrate the EINC practice, or the Essential Intrapartum and Newborn Care Practice. And for this demonstration, we have the description. So the description for this demonstration is the EINC, or the Essential Intrapartum and Newborn Care Practice, is a evidence-based standards for safe and quality care for the birthing mothers and their newborns within 48 hours of the intrapartum period, or the labor and delivery, and a week for the life of newborns. So we have also the three purposes for this demonstration or practice. First is to provide safe and quality nursing care for the birthing mothers and their newborns. Second is to practice the recommended practices during antepartum, intrapartum, and post or immediate postpartum periods. And lastly is to follow the recommended practices for in newborn cares. So now let's go with the materials that we are going to use. So we have here in this area, let's say for instance this is the weighing scale, even though this is not a real weighing scale. Let's say for instance this is a weighing scale. We have also the baby's layout or dress. And also we have here the baby towels, the diaper of the baby, and this one I'm going to use this later on as the underpad. And here we have the decontaminated solution, and here is a container wherein I'm going to put the decontaminated solution later on. And here I have also a container wherein I put the antiseptic solution, eye ointment, the BCG vaccines, the vitamin K, the hepatitis B, the cotton balls, and also the syringes that we are going to use, and the tape measure. We also have the oxytocin, the Mayo scissors or scissors, and we have also the Kelly's or forceps. We have also the umbilical cord, which is the plastic one, and also the name tag of the baby, and also the sterile gloves, 2 sterile gloves. Also this one is the sterile gauze, and also the what you call this one? It's a plaster. And also we have here the two kidney shaped basins, and also we have the bonnet of the baby, and also the blanket of the baby. I use this as the dummies, and I'm going to use this is the mother, just for the information. And also I have here, I provided a helipad. Here, the helipad, and also the container where I'm going to put the placenta later on. So I think those are the materials that we need. I also forgot this one. I'm gonna use also the stethoscope later on. And now let's go with the procedure. So first thing to do, in advance, we need to do a decontamination solution. In that, we need to mix a 1 part of 5% of chlorine bleach, and also in a 9 parts of water, and by mixing it to make the 0.5% of chlorine solution. And you can change that solution at the beginning of each day, or whatever the solution is very contaminated or cloudy. So, prior to the women or the mothers transferring to the delivery room, we need to ensure that the mother is in her position of choice in labor, and we can also ask her if she wants or she wishes to eat, drink, or to play. So, mother, do you want anything? Do you want to eat, or do you want to drink water or anything? And then make sure that you communicate to the mother and explain or inform her with the progress of the labor, and also give her the encouragement and reassurance. After that, let's say we are now in the delivery room. Let's just pretend that we are in the delivery room already. So in that, first thing to do, you need to make sure or to ensure that the delivery room area is in 25 to 28 degrees Celsius to eliminate air draft. And second to do is to ask the mother if she is comfortable with the semi-upright position, as it is the default position of the delivery room table. And after that, we need to provide the privacy, or we need to ensure the privacy of the mother. In that, if you are in the DR or delivery room area, make sure that you close the door and the window. And if there is a curtain, you need to close the curtain. After that, we need to, if you have a jewelry, put it off, and then wash your hand thoroughly by observing the WHO 1, 2, 3, 4, 5 procedure, which is, the World Health Organization 1, 2, 3, 4, 5 procedure. So I'm going to show you the proper hand washing. Okay, I hope you can see my hands. So here we have 10 steps, but this is not part of the 10 steps, but you need first to wash your hands with water. And the step 1 is get enough soap. And then step 2, step 3, step 4, to step 5, step 6, step 7, and then the step 8 is you rinse your hand with water. And then the step 9 is get a tissue. Oh, sorry. And then dry your hands. So you dry your hands. Right? Now you dry your hands. And the step 10 is the tissue that you use is the one you gotta use to turn off the faucet. Okay? So now our hands are clean. So after that, the next step is to prepare the newborn's resuscitation area. Make sure that it is clear and clean, and the materials are also clean and functional and within easy reach. Okay? So also you need to arrange the materials in a linear sequence, wherein we have here the surgical or sterile blots. We have also the oxytocin vaccines, also the umbilical cord clamp, which is the plastic one, and the instrument clump, and also we have the dry lining, the bonnet, the 2 kidney basin, and also the Mayo scissors. So here in this part also we have wherein it is in separate, because these are the materials that we are going to use after the first breastfeed of the baby. We have the eye ointment, the BCG vaccine, the hepatitis B, the vitamin K, and also the cotton balls, and so on. After that, we need to clean the perineum area of the mother. So in that cleaning the perineum, I actually searched about that, and it says there is a two way of cleaning the perineum. First, you can use a cotton balls. Here, you can just clean it with the with this antiseptic solution, or you can use a towel and then put an antiseptic solution on it and then clean the perineum. As you clean the perineum, after that is you need to wash your hands again, or use sanitizer or whatever. So let's say, for instance, I am washing my hands again because I am going to put the 2 pairs of surgical gloves or the sterile gloves. So before that, I'm going to put this first in this area first, because I'm going to use that weighing scale later on in this one, because I'm going to get the surgical gloves or the sterile gloves. In that, just a reminder, before putting any kind of gloves, make sure that your hands is clean. You can also advisable to wash your hands or use a sanitizer. In that, let's say I already washed my hands again. So first, you need to put off this. There you are. And in this, actually, you don't need this. You can just throw it on the garbage. Here, actually, I have this area where I can put all the garbages. So, there. That's my trash can, actually. And there you are. Oops. I think we need a lot of space here. Yeah. Okay, just a reminder again, do not touch the sterile gloves because it is sterile, okay? You need to observe the cleanliness and don't want to mess it up. So in this, I hope you can see it in the video here. So to open it up, do not touch the gloves, okay? So open like this, like that. Just open it. Okay. I think my space is not enough, so I'm gonna put here. Set aside first this one, just to show you how to put the glove in a proper way. As you can see again, I hope I can zoom it up, but you're not allowed to touch, okay, the glove. So there's a fold area here. And you can touch it like this, okay? You're gonna touch the glove first. Yeah, here you are. Okay, but I'm going to put it here first because I'm going to put this. Another pair of gloves. Alright. Oh, so in that, first this one. So it's up to you what hand first, but as I am a right-handed person, so I'm going to put the gloves first on my right hand. So by the help of my left hand, you can see here, hope you can see it, there's a fold area. There's a fold area where I can put insert my left hand on it, like this. You can see it in the video. And then my hand my right hand should, and my thumb will be toggled like this for me to have not a hard time to insert my hand inside the glove. So, yun. There you are. I'm sorry. And then other one, same stuff with it. Left hand with the help of my right hand. And I insert like this, okay? Okay. And then tackle your thumb. Oops, sorry. Hard. But I know this is my first time to do this. Actually. But as this one is sterile, so you can touch it like this now and fix as you are comfortable now. And then same procedure with the other one. I'm going to use 2 pairs of surgical or sterile glove because I am going to work with the umbilical cord and the premium. Okay, tackle, okay. A little hard than I thought. It's kind of a little hard than I thought, actually. Oh, putting another glove. Putting another glove, okay. So, there you are. Sorry, it's kinda hard for me to put another pair of gloves. That's harder than I thought. But you need that. But you can put your glove as quickly as you are practicing on it. I hope I can do it. So now we have our gloves on us. So the next thing is the delivery time. Now the mother is ready for the delivery. Oh wait, I forgot one line. Yes. I need this. I can do it. Oh, there you are. So now delivery time. You need to encourage the mother for pushing her baby. So, with that, we need to encourage her. Mother, we are here for you. We are assisting you, so I'm going to assist you if you are going to push. So, in that, you need also to prepare the dry lining at the abdomen of the mother. This is for the you need to prepare for the drying the baby later on. That now also we need to apply perineal support and we did the control in the head of the baby. So in that, mother, at the count of 3, I want you to push, okay? So 1, 2, 3, push. Again, at the count of 3, I want you to push, okay? 1, 2, 3, push. Again, 1, 2, 3, push. And in that, when the baby is out, you need to call the birth time and also the gender or sex of the baby. Okay? So, again, mother, I want you to push. 1, 2, 3, push. Time, it's 6 p.m. Baby is out. She is a baby girl. And you need to inform, you need to inform the mother for the outcome. So, mother, your baby is a girl. And after that, you need to get we need to dry the baby roughly at the first 30 seconds, starting with the face of the baby, second to the trunk, down to the extremities. So let's say the baby is out now and she is crying. Wow. I'm sorry, my phone is running out of storage, but let's continue. So, for what I know, I last read 1 to 3 minutes. So within 1 to 3 minutes, you need to remove the wet cloth, and then put the baby's dry ironing, or I think a blanket to warm, and then also put the baby's bonnet. And in that, put the baby on the mother's abdomen for the early skin-to-skin contact. There you are, baby. And by that, after the skin-to-skin contact, you need to palpate or make sure if there is no other second baby coming out. So let's see. Oh, I think there is no second baby coming out, so maybe we should give the mother the oxytocin. And by that, I'm going to use the 10 cc because we need the 10 U for the oxytocin. So let's say we get the oxytocin and then inject it on the abdomen of the mother. That is within the 1 minute after birthing, okay? Do not forget the cotton balls. So, we gave now the oxytocin. After giving the oxytocin, so before you cut the umbilical cord, you need first to put out your first glove and put it on the 0.5% of chlorine where you can decontaminate it at least 10 minutes. So there you are. You need to palpate the umbilical cord for the pulsations. And if the pulsation will stop, now you can put the umbilical cord clump to the umbilical, which is between the baby and the mother. So, mother, can I have your elbow first? Here. I hope you can see it. Oh, it's really far, but I hope I can move my camera in. I am alone. So, here, the umbilical cord clump, the plastic one. I'm going to put, or we should put the umbilical cord clump plastic in 2 centimeters from the base. So, there you are. And then the instrument cord clump, here, you can see, 5 centimeters, okay, 5 centimeters from the base. So, that's it. And now get the Mayo scissors. Now you can cut the cord not in the midway, but closer to the first clump that you put, which is the plastic one. Not so close, but closer than it. Okay. Oh. Now we cut the umbilical cord. Third out. Then after cutting it, we should continue the procedure in the what's that? AMTSL, which is the active management for the third stage of labor, wherein we wait for the uterine contraction and cord traction and the counter traction until the umbilical, until the placenta delivered. By that, you don't need to rush, or you don't need to rush to get the placenta inside the mother to put it out. You need to wait because it's going to coming out naturally. But you can help it by not pulling it quickly, but by doing this: up, down, side by side. Then roll the umbilical instrument cord clump. Roll it, okay, and then do it again. Up, down, side by side. Then roll it again. Okay, just doing that. Don't rush things. Don't rush it. Okay, it's coming out naturally. Up, down, side by side, and then. Okay, I think while waiting for the placenta to come out, or while waiting for the placenta to already come out, we should. So now, while waiting for the placenta to deliver, we should massage the uterine to firm, and check for the vagina if there is a laceration or tear. And I don't think there is a tear, because if there is, you need to repair them as necessary. Okay? And I think the placenta is coming out now. So I should prepare my container. Okay, here you are. Whoa, the placenta is now here. So I just want to see this. Okay, this is the placenta, and you need to check if the placenta is complete, because sometimes there are scenarios that some part of the placenta is still there, and for that you need to call the doctor to put that outside. But make sure you get the instrument clamp, because this is the thing, and put it on the container where is the 0.5 chlorine solution is, to contaminate it. Then now let's process. So the placenta is disposed now. So next thing to do is put the, should be prepared like this. Put this underpad at the back of the mother. So in that, you can talk to the mother, and mother, I'm going to put this underpad on you. So if you can help me, please, at the count of 3, please move your hips. 1, 2, 3. Okay, there you are. We have now it. The underpad is in there. After that, we need to stereo all the, or we need all to put the things that we use inside or on the 0.5% of chlorine to decontaminate them all. And also the last pair of gloves, and put it on the 0.5% of chlorine solution and contaminate it for at least 10 minutes. So within 15 to 90 minutes, we need to advise the mother for the feeding cues. Like for example, the baby is moving her head side by side, or her hands is like opening and closing, and if her hands and her feet are moving and moving like this, it means the baby is want to have a breastfeed. After advising her like that, I think, and also you need also to teach her the proper positions and attachments. And in that, after talking with the mother, I think that's enough time for the baby to have the fully breastfed. So you can get the baby for the mother. So mother, can you have your baby first? Thank you. Oops. There you are, the baby. And in that, you need to examine her, right? With the right. Here the baby scale. I'm sorry, my scale. So we need to weigh the baby. So what is your weight, baby? Okay. Sure. Oh, looks like she's healthy. And then you need also actually um the weight of the baby is, I think, 7 pounds and 3 kilograms. So she's healthy, okay? And we need also to measure her length. So let's see what her length is. Oops. Okay. So with the head or whatever. We're gonna use centimeter, okay? Centimeter. Here. So let's say the baby is 46. Her length is 46, so that's normal. And then also her head. Centimeter. Her head. After the head, so we need to know what is the head is, and then going down with the head. Alright, here. You see it? After that, you need also to have the up guard salt, or I think the up guard down. Like A is for the activity, the baby is moving. So it means the baby is active, okay? So she is healthy. B is for B is for the pulse rate. So the pulse rate of the baby is, I think it's 110. So it's healthy. And then we have upper letter G is the grimace. So that is when the baby is crying or what. So I think the baby is healthy for that. Upper, letter A again. We have T. What is that? A is for oh gosh, I forgot. No, I remember. The appearance. Yeah, the appearance of a baby is color. The baby, as you can see, is all pink, so the baby is healthy. And letter R is for Upgar. I think it's about the breathing, right? Respiratory, yeah, respiratory or the breathing, respiratory rate. Respiratory rate is, looks like it's 60, so it's normal. And the baby is healthy. After that assessment, or the physical assessment for the baby, you can, just like that, to keep her warm and give her the best vitamins. Check her with that. So first we need to have the vitamin K. I'm going to give her the vitamin K using a 1 cc of syringe and get 0.1 of vitamin K. And let me open this one and get 0.1. Okay, that's 0.1. Okay, I'm going to put this vitamin K on the upper right thigh of the baby. Actually, you need to have this three part on the thigh of the baby, and you need to put the vitamin K on the second part, or the part 2 of the thigh. So I'm going to put it now inside of it. Okay. Okay. I don't forget again the cotton balls. So there you are. The baby's crying. Maybe it's hurting. And then I'm going to put second is the hepatitis B. Using I can use the 3 cc of syringe and get 0.5 of hepatitis B. Okay. Okay, there's 0.5. I'm going to inject it on the right deltoid of the baby. So let's put it. Just a reminder, do not hit. Make sure that you don't hit veins because it's not good. By knowing that, so let me show you. Actually, let's say this is the syringe and you put it inside me, and then you're going to pull the plunge. And if there is a blood flow, means that is not good, so you need to put it away because you hit the wrong way. If there is no blood flow, means you hit good. So next I'm going to put the BCG vaccines using this 1 cc of syringe and get 0.05 of BCG vaccine. By that, it means on the half of 0.1. Oops, is that? Okay. 0.5. Oops. Yes. As I already put the hepatitis B on the right side of the deltoid of the baby, now I'm going to put this BCG vaccine to the left deltoid of the baby. There you are. Hit it. So now, so we're done by giving the baby the best protection that she deserves. Okay, now you can put this with her mother. Oh, come on, baby. There you are. There's your mother. And then by that, you need also, actually, we didn't wash the baby after the birth. Actually, we are advising that we need to wash the baby for after, I think, 6 hours is enough. 6 hours to protect the baby because there are chances that for the hypothermia or any infections. So we are avoiding that, okay? And also, you need to advise the mother for about the breastfeed, that the baby should be breastfeeding for almost 6 months. Then after 6 months, the baby can eat soft foods that they can swallow because they can't, they don't have teeth already, so the soft one. We also the breastfeed until they are 2 years old. Then after that, saying that to the mother. Again, in 1 hour or the first hour, we need to observe the color of the baby and the breath of the baby, and also the vital signs of the mother. And also we need to massage the uterine to about every 15 minutes. And in 2 hours, or in the second hour, in the second hour, we need to check the mother and baby diode for 30 minutes in 1 hour. And after that, complete all the records you need, and that's all. We need all the records that we need for you to know if the operation or the procedure is good. Okay, and a reminder that if you are on the DR or any operation, make sure you put your face mask on, because it's good. Actually, it's for your protection too. But as I want you to see that I am talking while I am demonstrating, that's why I am putting my face. I'm not putting my face mask on, but we should use face mask. So that's it. Peace.